So Namibia has a national e-health strategy of 2021 to 2025, and so it's actually expiring this year. And what this strategy actually emphasizes is just, moving from a paper-based record to sort of like an interoperability across like our labs, our pharmacies, as well as our clinics, as well as telemedicine services. So just to give an example, every time you use health facilities and you get your blood taken, the doctors will then have access to your blood work via an application. They will have access to, if they're in the health facilities, that's of course a hospital or clinic. And this is actually a project of NIP in collaboration with MedTech South Africa. And then, of course, we have like a number in Namibia. An example is like Patient Care, which is a telemedicine application. You can actually download it on Apple Store as well as Google Store. And then we have a very interesting one that I recently stumbled upon, which allows you as the patient to actually keep a record of your health information instead of using your, your health passport, like your yellow one or your green one. You can actually sort of transfer that information to this application. And this application is called Ukolele, and it's actually, interestingly, it's founded by a medical doctor who's actually a specialist in emergency medicine. That's, of course, Dr. Rauna Nashinge. Very, very interesting application, and I think it's really worth looking into. I wish I could give sort of a market projection, and this is really where, our health economists will come in. But I think that it's too soon to sort of give projections on market growth in terms of like how much, gross income can actually come from digital health in Namibia. And then finally, I think I would like to highlight that, there are also government initiatives for digital ID efforts. That's, of course, by the UDP in collaboration with the Ministry of Health and Social Services, Ministry of ICT, and they're sort of just really laying the foundation for integrated legal identity, data sharing, and e-health systems, sort of just kind of like building onto what already exists. An example is that when a child is born in Namibia, they are basically recorded, like the birth certificate is actually an birth certificate. So I think it's just building onto that. So that's somewhat what the landscape looks like in Namibia. It's still in its early stages, and because there's really a lot of groundwork to be done.
Why is digitization in healthcare so important for Namibia at this point in time?
If you've been paying attention to the conversations around digital transformation in Namibia in the past 5 years, you've noticed that health is actually sort of outlook. Health is not included. This health sector is not included in these conversations. I mean, you have like fintech. Our banks have gone digital. Ministry of Home Affairs has gone digital. FIFA has gone digital. Even agriculture is going digital. So we're really 4 days behind. And like on the ground, working as a medical doctor, there is a high demand for medical attention, but we have limited infrastructure. So in Namibia, about over 85% of Namibians actually rely on public health service. But the problem is that, our clinic, the number of clinics that we have, they haven't actually kept up with the population growth over the years. So what's happening is that our doctors are overworked and they're overextended with like long queues and constrained access. I'm sure you've heard the conversations on social media platforms and radio. People are complaining. I went to the clinic and I was there for 5 hours, for 12 hours. And every time a doctor wants to step out at lunchtime, they're being frowned upon because where are you going? Like, look at the queue of people that are here. So digital health can actually help to actually make healthcare facility or receiving healthcare much more efficient, as well as just make sure that there's sort of like a continuity of that care. A really good example is that, I know there's been conversations about moving, for example, from the paper record to sort of an electronic health record. And this will actually eliminate duplications and errors, right? One of the issues that we're seeing is that there isn't really connection between the private sector and the public sector. And I've actually written this in my article that was published in the Brief last year, where I was sort of just giving a picture of what it's like if you are to move from public to private or vice versa. If you are, for example, admitted in state hospital and then you decide that you want to go to private, when you go to private, they are going to take your health information from the beginning. Now, just imagine how frustrating So not only are they going to retake your health information, but they're also going to take your blood work, etc., and do the necessary X-rays or tests, right? But imagine if these two facilities could actually work together. It will make, receiving healthcare services just so much more smoother than what it currently looks like. But the reality of it is that, there's also the issue of, bridging the gap between rural and urban. Private sector only sort of like covers, I think, about 10 to 15% of healthcare in Namibia. So there's that as well. I think the time is now. I think that Namibia needs to sort of like align itself with WHO's digital health goals, which is also part of Namibia's Vision 2030. And this will actually help to just sort of like position us in the same category as every other country on the continent.
Let's talk about some of the hurdles. What's standing in the way of faster digital progress in healthcare?
I would say that the number one is actually regulatory gaps. As much as we have an e-health strategy, which is obviously expiring this year, there is the issue of the fact that we don't have an e-health. We don't have e-health laws. We don't have digital health laws. The Ministry of ICT recently came out and they said that they are still working on the data protection law. And one thing that we all need to take into consideration is that data protection law, especially when it comes to health data is very, 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 very sensitive. So we need those regulations in place. We need those laws in place. And this one should actually be easy for the government because the government is, of course, in contact with various countries. A really good example that I can give of a country that is really forward-thinking when it comes to digital health laws and policies in place is Kenya. I do know that, Kenya does collaborate with the Ministry of Health and Social Services, and they've actually positioned themselves to be sort of a country that is training African health ministers or health ministries on their progression in digital health. So we wouldn't have to start from scratch when we're actually creating our digital health laws and policies. It could be easily done just from looking at what countries such as Ghana and Kenya and Rwanda have actually done. Then, of course, the biggest one is infrastructure challenges. Digital health, unfortunately, it does require connectivity, right? Internet. But that sort of thing can easily be overcome, an easy collaboration with, telecommunication companies. I think NTC, Paratus, as well as Telecom can actually come on board. But then it's the thing of like, okay, so we get the infrastructure in place, we get the laws and regulations in place, but then it comes down to the fact that, again, health data is extremely sensitive information. So what is the country going to do to make sure that, this data is stolen? So I've actually, again, written about this. And I think that, as we're moving towards digitization of health information, we should also look at including intra-health. And this essentially just prevents, hackers from getting our health data.